Hello and welcome to another edition of our Neuse News Coronavirus Chat. I'm publisher BJ Murphy of NeuseNews.com. Thank you again so much for joining us. We've enjoyed bringing this to you, so thank everybody at home for watching. If you don't mind, go ahead and like and share the broadcast so we can get some information out there about what is happening with COVID-19 in our community and across the nation and our state today. We've got a very special guest today. I'm really happy that we're going to have Dr. Gregg Murphy on in just a moment. But first, I want to give you a few quick updates, if you don't mind. As of 10:55 this morning, the North Carolina Department of Health and Human Services confirmed that we now have 1,857 cases in our great state. We've had a 60% increase in our deaths, unfortunately, since yesterday. We're now at 16, and unfortunately, certainly expect that to increase some more. Since the NCDHS HHS reported this morning, Greene County added another case. They now have 5. Jones is still at 0. And right before we went on air, Lenoir County released that they have now confirmed their 4th and 5th case. And we'll post that link here shortly. So just go to facebook.com/Neuse News, or you can just go to NeuseNews.com to read the full reports from Lenoir County and Jones County. A couple things I want to point out on the statistics side. If you'll notice our update this morning from the North Carolina Department of Health and Human Services, they've done a really good job of trying to share more information. 9% of the COVID-19 patients in our state are between the ages of 18 and 24. So the young people are not immune to this, still need to be washing their hands and practicing social distancing. 42% are ages 25 to 49. 27% are 50 to 64. 20%, now this is interesting as well, 20% of all the cases in North Carolina, almost 1,900 cases, are 20% are 65 and up. But the 65 and up crowd, that age range represents 75% of the deaths in our state. So that is why it's so important, if you have a parent or a grandparent or a spouse, that you try to get them home or stay practicing social distancing as much as they possibly can. There is some relatively good news. We always like good news. Salvation Army announced today that they are taking leftover Christmas toys, and there's a little bit of a screening process that they will get them to kids who are having birthdays between, I think it was April 1st and May 31st, ages 0 to 12. So just go to NeuseNews.com and read that story. It affects kids in Greene, Duplin, and Lenoir County areas. I know they've got a lot of precautions they're taking with that, but I thought that was a little bit of a positivity in this news day. Also, if you jumped on just now because you got a breaking news text alert, thank you. If you have not subscribed to our breaking news text alert, please do. It's free, just like everything we do here at Neuse News. Just text the keyword NN to 484848. That's NN to 484848 for breaking news alerts. And thank you so much for doing that. And I also want to say a special thank you to Lenoir Community College, who's put out this very special and somber public service announcement with Neuse News. Thank you again to Lenoir Community College for that special message. And we're really excited today to have Dr. Gregg Murphy. He is a urologist from Greenville serving in the United States House of Representatives. He actually served in NC House for a few years, but he now represents Lenoir, Greene, and Jones counties in the United States House. He serves on 2 very important committees, and we'll talk about that in just a moment. He serves on the Education and Labor Committee, as well as the Science, Space, and Technology Committee. Dr. Murphy, no relation, but thank you so much for jumping on our chat today.
BJ, thank you for having me. Y'all are doing a wonderful thing, educating the public, and I really appreciate it. Thank you.
Thank you very much. Well, let's first talk about the two committees you serve on, the Education Labor Committee and then the Science, Space, and Technology Committee. Those seem to be two industries that, of course, I try to bulk those together, but two committees that would be seeing a lot of the policy regarding the infrastructure related to the COVID-19 response. Tell us a little bit about what you're seeing there.
Yeah, that's precise, rather. About 6 weeks ago, we had a committee where Dr. Fauci came and spoke to us about vaccines. This is before the full onslaught that hit our nation. So it's interesting to use my medical background and my science background to really help dive into some of those deep issues. And then education and labor. I've been an adjunct professor at East Carolina School of Medicine for a quarter century. I was on the board of trustees of my old alma mater at Davidson College years ago. So a lot of those experiences I've been able to carry forward. We actually had a committee meeting by Zoom the other day for education and labor, talking about the challenges that are facing our country. So many of the universities, community colleges, everything now are out. And they're having to access their instructional education materials online and really carry their education forward in that regard. And some of the challenges that they're meeting are not only professors not being prepared to instruct that way, but actually making sure that students are able to access this issue. We talked a little bit about broadband and the challenges that we're having there, especially in our rural areas, and how we best can confront those. We're dealing with, I've had this described to me as building a ship or building a plane while you're flying it. In some regards, that's a good analogy. We're learning hour by hour how this virus is affecting us, not only physically, but economically, spiritually. And I believe we have a lot of good folks, Republican and Democrat, that are working hard to ease the suffering of our nation.
And speaking of the bipartisan, the crossing the party aisle aspect here, the U.S. House voted last week in session to basically unanimously through a voice vote. Maybe it was one dissenter, but voted to pass the CARES Act. Tell us a little bit about the CARES Act and what that does and why that was so important to you.
Yeah, BJ, that was the third major piece of legislation that we had done this month, or actually back in March, to confront the epidemic and the challenges that it presents upon our country. The third piece, the CARES Act, was a $2 trillion, largest in our nation, to try to provide not a stabilization package for our nation, not a stimulus package, but rather a stabilization package for our nation. We're not in a sprint, we're in a marathon, and we're just trying to get businesses and individuals steady enough that hopefully in 2 months we'll start seeing a semblance of normalcy and be able to carry those businesses through their very tough time, keep people employed, keep people financially sound, until we can really crank our economic engine back up again. But that was the main focus of that bill, trying to keep hospitals solvent and really trying to address all aspects of this crisis.
And we'll try our best. It was a jam-packed bill across a lot of different industries, but let's see if we can try to peel back a few just for a second. Neuse is a small business. In fact, we are completely free. We're run through advertising. That's through the generosity of our local business industry. So we know we're not selling any ads right now, and so we're doing our best to give back and to try to keep things afloat. We've done some things in house. We're doing these remotely now. Like Dr. Travis Town is behind the scenes at his home office. Lethal Throwers at our office and trying to manage the social media side. Tell us a little about what you're hearing from small business owners and how they're trying to survive this economic onslaught.
This is a challenge, unlike we've ever had before. Small business owners are understandably very concerned. A lot of these small businesses are mom and pop shops. They've worked their entire lives to create a small business, and then poof, overnight, it is really, really challenged. And so what their main concern is, how do we access capital? How do we access money to keep our employees on the payroll, help us survive our business and keep our business alive during these next 2 months. And then, on the other side is you've never seen the federal government, or any government for that matter, work as quickly as this administration has tried to put together packages, procedures, mechanics of how to address getting out these loans and getting money into the hands of people who desperately need it. Tomorrow, April the 3rd, is when small businesses should be able to access financial institutions to begin the process of getting money back in their pockets. There has been some reluctance on the banking industry and lending industry because they're still not 100% sure of regulations, which is understandably so. I mean, they're literally staying up all night long trying to create the processes of how lending institutions can access the money to be able to give it to individuals. There's going to be, I'm going to be very honest and transparent, there's going to be some frustration in the next week of getting processes and loans pushed through so that people can access the money. But I will tell you that folks, very, very smart folks, very, very diligent folks, are working 24/7 to try to get this process as smooth as possible and get money into their hands. The good thing is that the hundreds of millions of dollars, in fact, small business stabilization, if certain things are done, you keep your employees, you have to use 75% of their loan amount for payroll payments. If that is done, then the loan is forgiven. It's a grant. Mm-hmm. And so it's not going to be a further hindrance that's put down the road to push on businesses.
Right. And look, I will tell you that here at Neuse, we've actually looked at that ourselves because we're still trying to keep things afloat as well. Let's switch real quick to education. I saw Turner White ask this question. He's a student, and he says, is there any information about students' final grade if we do not go back this year? What's the status on education, schools being able to go back, and how this will affect their grades?
I think that's a fair question, and one of which I do not have a perfect answer for. We're really writing so many different books and chapters literally at the same time. I do not believe that I don't think that teachers are going to want to hurt their students because they can't access things. I think that there'll be a lot of processes in order to preserve the educational opportunities for our kids, for our students, and hopefully not adversely affect grading or any of those other matters. This is a challenge. I wish I could tell you exactly how things are going to occur. A lot's going to be up to our state Department of Education, and it may go down to local educational administrations on how they administer things. But I think that's a genuine concern and one that's well-founded. But I want our students to know that good people are really concerned about their education and are doing their best to help work through the processes that will make that complete.
Thank you for that question, Turner, and thank you for that, Dr. Murphy. And look, if you're watching this and you've already seen some value and you know that some of these questions are questions you're thinking about or you've talked about at your home, please share this broadcast so other people can get this very valuable information. We're honored to have U.S. Congressman Dr. Gregg Murphy with us here today to try to answer some of these questions. We know he's been very busy, so we thank him for his time. There was on the medical side of things, and I still want to kind of go through some of this, but we did have a question about, I know, and you're uniquely qualified for this question because you all are a trained physician. You are a urologist, and you're serving in Congress. There was a question about, are homemade fabric masks worth making and using? That was a question from one of our viewers today.
I think that's a very big issue. The real question is, does a mask protect you from getting the virus, or does it protect other individuals, in other words, someone who's infected already, from spreading the virus? We know the answer to the last question. If someone's coughing or sneezing and they're wearing a mask, it definitely decreases the spread of the aerosol. Whether it really protects an individual just wearing a bandana or some other covering from getting the infection, that's debatable. There is some data that's coming out of Asia where individuals are much more inclined and much more used to wearing masks. That may help prevent some individuals from getting infected. I would never, ever tell anybody not to do it. Whether it really prevents someone from getting infection is really up to be seen. At this point in time, I would urge people not to go online, not to buy masks, only because there's such a dire shortage of them. We do need them for our healthcare workers first and foremost. Those are the individuals who are on the front line that are coming in contact with people we know to be infected, and they're the ones who need the masks. We do know that this particular type of mask, something called the N95 mask, is probably the best one to prevent the spread of aerosolized virus from you getting infected with those. The other masks are really just kind of a protection that prevents just particles in and of themselves. So if you can do something and you want it with a bandana or a homemade mask, great. Please don't, however, deplete the supply that should be going to our healthcare providers.
Thank you for that. And back to the CARES Act just a little bit. There's a question that I had, and I noticed that one of our viewers today had as well, and it was related to unemployment filings. I saw a graph today that showed, unemployment kind of like this over time, and then over the past week, it's just a tremendous spike like we've never seen before. Tell us about unemployment. What happens if you get denied? Let's talk about that just for a second.
All right. So unemployment is a benefit that's given to us by state governments. Employers pay into it. And there's certain conditions that essentially, if you're fired, you have to be trying to get work, keeping that process going, looking for work, and you're able to receive benefits. That's the normal structure. Now, with the CARES Act, individuals, we've given more money to the states for those unemployment benefits, and individuals can access those. But please understand, that's a temporary benefit. I've heard from some businesses that their workers are asking to be fired, essentially trying to go on vacation for a few months. Please understand that that's really counterproductive to our society, to our nation. Once we get over this hurdle, again, hopefully in 2 months, we want to have a workforce. We want to be able to continue doing what we were doing 2 months ago. And so while individuals, by all means, if you need to file unemployment, you do so. But if your employer really wants to keep you on and he's getting one of these small business loans, then please stay on the work, contribute doing what you were doing before, make it easier to come out of this crisis.
I appreciate that, and thank you for the question we got from Facebook on that as well. Thank you for answering that. I want to ask you a little bit about the administration. You've had, I'm sure you've had a chance to have conversations with the administrators of the White House, Vice President Pence, or even the president himself. Tell us a little about your confidence in Dr. Fauci, as well as in the coronavirus task force that the president tapped the vice president to lead.
Well, I think we couldn't have had a better individual heading the infectious disease department at the NIH at this point in time. He is legendary in his field. He did the initial work and made some of the breakthrough discoveries with HIV back, 30 years ago. He is a no-nonsense kind of guy, and we've seen that when he's doing his press conferences. He's able to cut through the chase and see exactly what the problems are. I think he's a great leader in this. I think he's very smart, he's very pragmatic, and he's realistic. He's talked to the people in terms that I believe people understand, and he's able to comprehend the magnitude of this problem. I have great faith in him, and Dr. Birx for that matter also. She's been a fantastic leader. I've spent the last 3 or 4 weeks speaking with infectious disease experts, scientists, epidemiologists, any expert I could get a handle of to try to get a handle of the medical aspect of this and what can we expect and how long can we expect. And I think Dr. Fauci and Dr. Birx are tremendous leaders. to help us get through this crisis.
And let's talk about one of the challenges that that task force is facing in relation to the medical industry is, and you alluded to it a while ago, it is the status of the PPEs, the personal protective equipment, the gear that our medical professionals are using. I know that the federal supply is becoming drastically depleted. Can you give us an idea on manufacturing and construction, our ability to amp that up? So not only that we have a federal supply, but even down here at the local level, we can have access to the correct PPEs.
Yeah. So I think it's very important to note that we have stockpiles, we have prepared areas, or areas that have tried to predict and prepare for pandemics. But just like this nation on December 8th, 1941, we were not ready to fight Japan. I don't think we understood or really expected a problem of this magnitude. We have national stockpiles. We've had those. They are being sent out to hospitals and states across the nation. But we have a shortage. There's no doubt about that. And this is, again, goes back to the masks. Let's leave those for our healthcare. The piece of gear that nurses, emergency responders, physicians need to wear to help protect themselves from the virus is in scarce supply. We're trying to get that to individual states. Atrium, which is the big health system over in Charlotte, had some of their supplies actually taken away by FEMA, redirected to New York or somewhere where the need was greater. So there's been some of that on the federal level to try to redirect supplies to hotspots. Now, what is industry doing? My gosh, they have jumped into the fray to try to change what they do, to try to supply masks, protective gear, gowns, ventilators for that matter, to try to meet the challenge that our nation faces. Or is it going to be enough in time? I think that's going to be challenging. Is it something that, again, we're in a marathon, we're not in a sprint, that will need long-term? By all means. And so all the different industries that have kicked in and changed from making cars to ventilators, they are doing a fantastic job. And that's what being American is all about. You know, BJ, when all is said and done, this isn't about being Republican or Democrat. This is about being American, and this is about community. The fact that people are coming together to help each other is just a tremendous joy, a tremendous silver lining in all this. And our industry has been a great part of that so far.
And let's talk about a little bit of hope just for a second. Do we have a decent idea on how long this may impact our ability to keep our schools to open them back up? The businesses are closing left and right. Do we have an idea of everything that we're doing, from closing industry, closing schools, to social distancing? Do we know if that's actually affecting the curve that we've heard so much about now? And how long till we have a good idea of when that's going to when we know it's actually working?
Yeah, that's the question on everybody's minds. When do we take our foot off the brake, and when do we start relaxing things? We can't know exactly what's going on in our country at this moment in time. I still think we're on the, as they say, the left side of the curve where that peak is coming up. What we can do is we can look at other countries. We can look at Italy. We can look at Spain and see what's going on there. I will tell you, from day one, we haven't had reliable information coming out of China. They to this day are not giving us reliable information. So while we have to kind of rely on some of the information coming out of there, we can't trust it, and we can really only try to look at countries that are more open and that we can actually understand what's going on. I'll be very real about this and be very transparent. I'm a surgeon, and we deal in the world of reality. I don't plan for the next step. I plan for the third, fourth, and fifth step, and that's what I think we need to look for. I think giving a realistic expectation, and again, this is after talking with many, many experts, I think it'll be the end of May until we can start take it. And will we have another relapse in the fall? Most likely. That's just the way that a virus is cyclical. We don't have any immunity to this virus. Compared to the flu, we have a vaccine that comes out every year. We don't have any vaccine for this, and it'll probably be 12 to 15 months until we get one. So it's going to be some herd immunity, but we're going to hopefully have good procedures in place. We're going to hopefully have medications that second wave, which is bound to come in the fall, will be a lot more muted.
And last couple of questions for you, Dr. Murphy. One is, I know a lot of this response is federal in nature, then it's state, and then it comes down to the counties. I've seen some chatter about what cities are doing, but a lot of cities are actually adhere to the county health officials and the county emergency management. There certainly is a lot of communication, don't get me wrong, but this is really a federal, state, then a county led effort. How is your office working with the state of North Carolina, Governor Cooper's office and his administration?
They've been working constantly. I was on call with the governor's office last night. This morning, I held a teleconference today with all the municipalities and all their leaders, city managers, county managers today to talk about their concerns and redirect them to my staff that we'll take each of these questions and research them. The last thing I want to do is have misinformation that goes out. The states are going to get $139 billion apportioned to them. I believe the count for North Carolina will be about $4 billion. And what's happening is our cities that have more than 500,000 can apply directly to the Treasury to access money. The rest of it proportionally will be returned to the state government. And that's where our state budget officer will work on a formula, a fair formula to reapportion money to individual municipalities. So, a small town that is losing some revenue because they can't access money that would be paid in fees and everything that the governor told that they don't need to pay for 2 months. It needs relief, and they need relief quickly. So that's what we're working with our county governments, our state, and our federal governments to try to ease this process.
I was glad you brought that up because I was going to ask you, as a former mayor, I was going to ask you about the utility side of that equation. But look, again, first off, thank you again for being on, and thank everybody for watching. Are there any final comments you'd like to share before we transition?
Well, my office has been open since the beginning of this. Not physically in our office, but every single one of my staff is on their phone. They're having conference calls a couple times a day, working through constituent issues. There are issues that are going on besides COVID-19 with our veterans and other things, but we have a fantastic staff, and they're working so hard for the people of Eastern North Carolina. I will tell you, this is going to be tough. This is not going to be something that's gone overnight. It's going to be a change in the way that we deal in business and the way that we deal with each other. We're going to have to learn a lot of patience with this, but I really do believe that we will come out stronger as a community, as a state, and as a nation when we're done this. It's brought out a lot of highlighted some problems. We have problems with China and supply chain and readiness. But I think we learn from those. We don't finger point. We don't say, what if? We say, this is where we are now. How can we best move forward? And I believe that's how we govern.
Well, thank you, Dr. Murphy. Appreciate your expertise, not only as a urologist, but also serving a state house and now in the United States Congress. You stay safe because we need you fighting for Eastern North Carolina. Thank you again.
Well, God bless you. Thank you for the opportunity. Stay safe.
Yes, sir. Thank you. And look, I just want to say thank you to everybody who's watching. If you found value in this conversation, please do us a small favor. Share this broadcast with some family and friends. Throw a few hearts up for the medical community because they're really on the front lines of this. And just to kind of reiterate what we said at the beginning of the broadcast, today we found out that Greene County announced that they have confirmed their 5th case, as well as Lenoir County right before we went on air confirmed that they now have 5 cases as well. The number of cases in North Carolina in terms of death have gone up the last day. And as you heard a congressman say, that we expect a spike to happen real soon across the country. And so, look, we just got to keep doing our part. I know I'll end each broadcast here talking about washing your hands, but it can be that simple, folks. And that's what we really want to encourage you to do. I want to say thank you to everybody who's subscribing to our newsletter. It's in your inbox every morning at 7 a.m. I thank all of our advertisers who are sponsoring. Look, if you go on our website and you see an ad, please click on it. Either it's supporting the small business who is supporting us, or it is a small monetary ad revenue that helps Neuse. So all those little things, it doesn't cost you but just a click, and it certainly can help us and help the people who partner with us. I just want to thank you for that. Also, if you got on this broadcast because you got the text alert, I just want to say thank you. If you're not getting our breaking news text alert, something we started a little over a week ago, we've got close to 700 people subscribed to that now. Just text the keyword NN to 484848. That's NN to 484848. And you will be subscribed to our breaking news text alert system. Also want to say a big thank you to Lenore Community College. Hope you enjoyed their public service announcement. If you have any questions for the college, please make sure you go to lenorecc.edu. And as always, please stay safe, practice your social distancing, grocery store about once every couple of weeks, and please make sure to wash your hands.